For our presentation, we will be comparing and contrasting Denmark and India's health systems.
In Denmark's universal decentralized health system, it is the Danish government's obligation to promote population health and prevent and treat illness, suffering, and functional limitations. This is to ensure high quality care and easy and equal access. It also promotes service integration, choice, transparency, access to information, and short waiting times. Whereas the Constitution of India obliges the government to ensure the right to health for all. Healthcare in India is chronically underfunded. Only about 37% of the population are covered by any form of health coverage from the years 2017 to 2018. India is currently working on reducing wait times in hospitals, improving quality of public health services, and improving workforce and infrastructure shortfalls. In Denmark, the national government sets the regulatory framework for health services and is in charge of general planning, monitoring care quality, and licensing healthcare professionals. The national government also collects taxes and allocates funding to regions and municipals based on socio-demographic criteria and activity. People are able to seek supplementary care to satisfy copays through their work. The general regulation, planning, and supervision of health services includes overall cost control mechanisms that take place at the national level through Parliament, the Ministry of Health, and 4 government agencies: the Health Authority, the Medicines Agency, the Patient Safe Authority, the Health Data Authority, and the Danish Agency for Patient Complaints. Under India's decentralized approach to healthcare delivery, the states are primarily responsible for organizing health services. India's health system is divided between the central and state governments. At the federal level, the Ministry of Health and Family Welfare has regulatory power over the majority of health policy decisions, but is not directly involved in healthcare delivery. The ministry comprises 2 departments. The Department of Health and Family Welfare is responsible for organizing and delivering all national health programs, and the Department of Health and Research is responsible for promotion of health and clinical research. They also develop health research and ethics guidelines that lead to outbreak investigations and provision for advanced research. One important scheme aimed at reducing financial catastrophe and vulnerability for lower income populations is the National Health Insurance Program. As of 2016, about 41 million families are enrolled in this program.
How universally does the insurance system cover the intended groups? In India, according to the Commonwealth Fund, the health system in India is universal, which means every citizen can get free inpatient and outpatient care. Fortunately, the Constitution of India secures health insurance for every individual. However, there is not enough money to fund many public clinics and hospitals. The population group that suffers mostly from this are low-income individuals. In Denmark, as mentioned in the Commonwealth Fund, Denmark also practices universal healthcare system. Basically, every person who lives in Denmark is automatically medically insured. This includes undocumented citizens. Also, every person who has the right to choose one of 2 healthcare options. Both options secure medical help for little to no charge. This makes it equal for every individual to receive the best insurance, no matter immigration status or socioeconomic status. What conditions are covered? In India, outpatient care procedures done in clinics and hospitals that do not require overnight stay. For instance, x-rays, physicals. Inpatient care procedures, surgeries that require hospitalization for a couple of days. For instance, like open heart surgery, kidney surgery. Drugs, post-hospitalized treatment. In Denmark, primary and preventive care, specialist care, hospital care, mental health care, long-term care, and dental service.
How is money raised for the insurance system? In Denmark, they raise money for insurance through taxes, and the national government distributes healthcare funding to many regions as block grants. And in India, for low-income people, the government launched the National Health Protection Scheme, which is funded through government taxation. And also, people pay out of pocket for private healthcare. Who provides health services and how does the insurance system pay them? In Denmark, GPs provide health services and they are paid by regions via capitation and fee for service. Self-employed private providers also provide care and they are paid by the region on a fee-for-fee basis for public patients, or they're paid through national negotiations between regional representatives and physician associations. In India, the PHC provides curative and preventative care services to people and serve as a referral unit with 4 to 6 beds each. There are also sub-centers that provide obstetric care and specialist consultations. They are paid fixed salaries, which varies depending on the type of work and level of specialization.
Hi there, I'm Kimberly, and I'm going to be talking about private insurance. So in Denmark, there are two forms of private insurance. Roughly 42% of the population have what is known as private complementary coverage, which is provided exclusively by nonprofit organizations in Denmark. This particular coverage covers all co-payments related to physiotherapy, pharmaceuticals, and even adult dental care. Secondly, 30% of the population have what is known as private supplementary coverage, which is provided through private employers somewhat as a fringe benefit to cover elective surgeries, for instance, which are not necessarily covered by the state. And just as a side note, fringe benefits are like incentives an employer offers a worker upon being hired. As far as India, things are a little bit different over there. Private insurance policies just entered the country's market as of 1999, which is why only about 36% of individuals who are insured have some form of private insurance, which only covers hospitalizations and after-hours care. In India, hospitals are somewhat of a monopoly for private insurances because public hospitals only account for 10% of the total hospitals throughout the whole country. The other 90% of hospitals are strictly ran by private sectors which operate on a fee-for-service basis with no sort of standardization for service price. This is why collectively, private insurance only accounts for roughly 4% of total health expenditures in India.